we recognise a group of patients who do really badly. And so the Nordic group looked at p53 mutations, not deletions, mutations particularly. Well, they looked at deletions as well, but mutations were the things that predicted for a really bad outcome. So these are young patients in the Nordic trials. So these are young fit patients in trials receiving high-dose cytarabine, having an autograft. And basically their survival, if you've got a p53 mutation, is under 2 years. So they do really badly. And we also know this group of patients don't do very well with BTK inhibitors. So we recognise this group of young patients with bad outcomes. And they're usually the blastoid patients. That's the highly proliferative ones who struggle with getting into remission in the first place. So my approach to that group of patients is to do allogeneic stem cell transplantation. And I think again, it comes back to what I said about the excitement with new drugs. You forget about old things that work. An allogeneic transplantation offers potential cure for these patients. We do use it in a relapse setting in very young fit patients. And certainly my approach in a young patient who's either got a blastoid presentation, because they're going to be these p53 mutated. I'm now looking for p53 mutations in my frontline patients. I'll do an upfront allogeneic stem cell transplant. We have in press right now a publication from a study in the UK where we did upfront allografting in mantle cell patients. It's 5-year follow-up and there's an 80% survival at 5 years. Now, we haven't actually looked at well, we're looking for p53 mutations right now because we didn't know that at the time we did the study. We were just looking at how applicable that was. And that was pre-BTK inhibitors. I don't think that challenges, in fact, I say in the paper that we don't suggest this challenges the conventional treatment, which is autologous stem cell transplant, but I think it gives you good evidence that it's a safe thing to do up front, and so to take those bad risk patients to do an allograft, I think that's evidence to support doing that.